So we're just going to go one at a time up here. Good morning. And I guess I don't have to raise my voice. You can hear me with the microphone. It's both a pleasure and an honor to be with you this morning to kick off this announcement today with partnerships, so many partnerships to make this happen here. And it's a beautiful day, the weather, and people lined up to get their shot today, their vaccination today. It's a good thing. We're here at Beardsley Park at Beardsley Zoo in the city of Bridgeport in the state of Connecticut in the United States of America, and it is great to be part of a team that is leading the way to get us out of this over a year now long pandemic. I have the pleasure of introducing a number of speakers today, but before I do, I'm going to take a moment as mayor of the city of Bridgeport and welcome everyone. Welcome here to the first in the country here, set up this mobile unit that will provide vaccines to those that are waiting in line and hundreds more over the next few days here in the city of Bridgeport. And we talked about the significance of this on a national level, but I will tell you on a local level, Governor, and to all those, Senator, and all those that made this happen governmentally. It means a lot to the people in Bridgeport, but I believe in cities across the country, sometimes feeling not first in line, frankly, oftentimes felt to be last in line. Maybe those that are not receiving the greatest of services, we might say sometimes feeling underserved. But today, this is not just a statement in words, this is a statement in action. We're making the first mobile vaccination center in a city, here in the city of Bridgeport, and providing it to our residents and residents from beyond. So we greatly appreciate that and welcome that. Our council president, Ida Neves, is here, and she's going to talk in a couple of minutes. But before she does, I would like to introduce, as he comes up here, the CEO of Hartford Healthcare, and let you know that they are and continue to do an outstanding job leading and partnering on getting us through this pandemic. Their strong presence throughout the state of Connecticut and their strong presence here in the city of Bridgeport has made a difference in treating individuals, but also in saving lives. I was up at, as Jeff Flack comes up, I'm going to say the governor and I had an opportunity to visit one of our friends up at the hospital today, and he's being taken care of, I think, with the best of medical attention that can be provided anywhere. Look, I'm going to pick this up a little bit. We're going to ask for a round of applause as we welcome the CEO, Jeff Flax, up to the microphone from Hartford Hospital, Hartford Healthcare.
Thank you, Mayor Ganem. This is a great day. This is a great day for the country. It's a great day for the state of Connecticut. It's a great day for the city of Bridgeport. We're so grateful for the partnership we have with FEMA, with the National Guard, with the health systems throughout Connecticut who are supporting this effort, and with the state of Connecticut government. We're very grateful to Governor Lamont. This type of partnership, the coordination, everyone pulling in the same direction, this is a tribute to the leadership that our governor has displayed in this moment and throughout this crisis. And it's been absolutely enormously important, and it's why Connecticut continues to rank amongst the highest states in the country in terms of our effectiveness in testing, our effectiveness in having the proper PPE within our state, our effectiveness in maintaining and managing our critical care capabilities, and now in this moment, our effectiveness in delivering the vaccine to as many people as quickly and safely as we possibly can. That is the culture that has been created throughout this crisis. And as I've often said, during this crisis with COVID-19, we don't wear any uniforms. We wear one uniform, which is the state of Connecticut. And it's wonderful with this FEMA initiative, with Connecticut being selected to be the first in the country, that there will be health systems throughout the state working together in partnership, seamlessly handing this off as we go forward. We are enormously grateful to Senator Blumenthal, the congressional delegation, who've been exceptional advocates on our behalf in Washington throughout this crisis. This is a critical moment. In this critical moment, there is a race that is occurring, and the race is to get this vaccine to as many residents within our state, to as many people, into as many human beings' arms as quickly and as safely as we possibly can. We have made a commitment, and our commitment is to ensure that no community will be left behind, and we're making great progress. Under the state's leadership, the governor has targeted 50 different zip codes where we are now channeling significant components of our vaccine to ensure that we reach the communities where there is disparities within healthcare, where there have been inequities. I look at our work within Hartford Healthcare just over the last 3 weeks. We went from 34% of our vaccines 3 weeks ago, targeting those 50% of those 50 zip codes. Last week to 36%. In this week, because of this effort, we will be crossing 39%, and optimistically, we believe we will cross 40%. In this moment, we need to ensure that we leverage all of our capabilities, all of our resources, and continue to use all of our ingenuity to get the vaccine to our people. Now, today, we're inaugurating the first FEMA van mobile unit that is being put forth in the country. And this will allow us this week in the city of Bridgeport to vaccinate 3,400 people over the next 10 days, which we're tremendously excited about. But we, over the last 4 weeks, have sent out our own 2 mobile units 40 times. And we know the impact that it has and how we can impact meeting people where they are. Right, in healthcare, we operate 8 mega sites today across Hartford Healthcare, across the state of Connecticut, and we have 22 fixed locations. But we can't expect people to come to our locations. We have to bring the vaccine to where people are. And I'm enormously proud of the work that's being done, the ingenuity of having ride services in place, of creating community partnerships, and the success of addressing health equity today within our state is a result of the tremendous partnership and the alignment with trusted community leaders. And here in Bridgeport, this unit will move 5 times over the next 10 days. And we will be in 5 different sub-communities within Bridgeport, working with trusted community leaders, delivering the vaccine in a very personal way and making it as seamless, safe, and effective as it possibly can be. So in this moment, I urge everyone to continue to maintain all of our attention around proper social distancing, wearing a mask, good hygiene. Our vigilance is absolutely critical because there is a race occurring. And the race is to get the vaccine out as quickly as possible to as many people so that we can stop COVID-19 in its tracks. And as I conclude, I want to recognize our frontline healthcare workers. Right, when I describe the 40 different mobile units that we've sent out over the last few weeks delivering the vaccine, or today, our National Guard, the partnership with the Department of Local Public Health here in Bridgeport, and all of our frontline healthcare workers within Hartford Healthcare and our partnership health systems at Trinity Health New England, Griffin Health, and the University of Connecticut School of Medicine and UConn Health, all of these frontline workers, the work they do, the agility they show to operate a system like this is beyond important. And we know the incredible work that people in the front lines of healthcare do every day. But in this moment, it's never been more apparent, never been more clear in terms of the heroic work that they do. And we are enormously grateful. So thank you. We couldn't be more excited to be inaugurating this today. We know we're going to make a tremendous difference. And we look forward to continuing to bring as much vaccine to as many people as quickly as we can. And again, we couldn't be more grateful to the state of Connecticut's leadership, our federal delegation, for making this possible today. This is an enormous step forward for the country, and we're delighted to be on the front lines of doing this here in Connecticut, and particularly within our city, within the city of Bridgeport. Thank you.
Sometimes, at least in Connecticut, you think of FEMA if you're not involved in government, which we work with them all the time. It's one of those organizations that kind of doesn't have a face or a picture to it, but they're there and they're here for us today. And if you look behind us, that's the picture. And as Paul comes up, this is one of the faces that maybe you don't see, but who we owe a great debt of gratitude to for helping to make things happen here today and all over the country. Let's give him a warm welcome as he comes up. Come on up, Paul.
Morning, everyone, and thanks for giving the opportunity to say a couple of words. I would be remiss if I didn't thank my friend Bill Hackett, who is the Director of Connecticut Emergency Management, who we have a relationship with and have had for the last 14 years. We couldn't do it without the state and about the partnership that we have and have had and will continue to build across this spectrum. You think about it, FEMA does disaster response and recovery. That's what our job is. But to think about a year ago, more than a year ago now, we had the President of the United States declaring 56 disasters all in at one time across our great nation and our territories and tribes associated with it. It's really, it's unbelievable the amount of work that has been done. We couldn't do it without the state of Connecticut. We couldn't do it without the congressional delegation, because they are the ones who do the work to give us the money that we need. They're the ones who are truly responsible for this unit that is here behind us. You know, FEMA is committed to providing resources to all available tribes, states, territories, and all of our partners as we go forward. As the federal government works to increase the supply of COVID-19 vaccines, FEMA is taking the steps necessary to build what is necessary to be able to deliver those vaccines. For some people, limited access to medical providers, vaccine clinics, lack of mass transportation, mobility issues, work, family care is associated. Those are all things that they have to consider when we put these sites in place. One of the requirements that the state certainly met was that they have to come up with a plan as to how to use this unit for the 60 days that it's here in Connecticut. Currently, it's going to be in 17 different locations over that 60-day period of time, and I think it'll make tremendous use of the vaccines that are available. Talking about the vaccines, we have the Janssen vaccine, we have the Moderna vaccine, and we have the Pfizer vaccine. I understand today is the Janssen vaccine, which is, as I refer to it, as a one and done, which is great. But the vaccinations, I think, are going to become more plentiful, and units like this and units like what Jeff talked about in terms of the number of units that are going to be out there, I think you will find as time goes on that you have a much better supply of vaccinations to be able to move forward to make sure that every person in America has an opportunity to get vaccinated. Mobile vaccines will bring to hard to reach places that people don't necessarily feel comfortable coming to. As you set the unit up, you put it in, as someone made reference to, the 50 most vulnerable zip codes in the state of Connecticut. Those are the kind of things that make a huge difference in terms of equity of vaccinations and equity of availability of vaccinations. They talked about the partnership with Connecticut when I first started, and without the partnership with Connecticut, the money that has flown into to bring this unit here and to support the things that are going on with the National Guard, and to support the things that are going to continue to go on through the state of Connecticut, they wouldn't be able to be accomplished without the partnership that we truly have. And the last thing I will say is, on the federal side of the house, the United States Department of Health and Human Services and the Centers for Disease Control have been pivotal in us being able to do our job. FEMA's never been involved in a healthcare thing like this, so without the CDC and without the Department of Health and Human Services, we wouldn't be able to do it. I really appreciate the opportunity to say a couple of words today. Really makes a difference to us, and I am the guy who was standing behind everybody else, and that's really the place that I'm comfortable. I'd rather be back there, but we're here to support as we go forward, and we'll continue to be that as we go forward. Thanks very much.
Thanks so much. Thank you so much. And back on a local level, as I opened, I mentioned this location. We're here at Beardsley Park at the zoo, and it's a beautiful. This is the Park City. It's a beautiful location. But I think what really is probably not in the scene today, but needs to be mentioned, is that not only is this a commitment as this first in the country here in Bridgeport, but it's in a city, and there'll be 5 other locations that were mentioned earlier by Jeff, and they are really in the neighborhoods where we need to reach out with mobile units to make sure that everyone has the ability, the physical ability and access to getting the vaccination as soon as possible. And our council president, Heidi Neves, has always made it a point, Mayor, what are we doing in the neighborhoods? What's going on the east side of Bridgeport? What's going, as Andre Baker's here, what's going on in the east end of Bridgeport? What's going on in the south end and all of our neighborhoods? Well, this will move in a couple days to East Main Street site. Then it will move over to another site in the city of Bridgeport and go right into the neighborhoods, some of them high-rise, multi-family units where maybe people are having difficult making it out to get the vaccine. And so the voice for so many of the neighborhoods, and a partner for me on the city council is our council president, Aydin Nieves. I want to give you a round of applause when you come up, and thank you for all your hard work.
Good morning, everyone. It's a pleasure to be here this morning in this monumental moment here in the state of Connecticut, but also in the city of Bridgeport, when we talk about the city of Bridgeport is made up of 70% people of color. We're talking about Latino, African American, a large migrant population, and a large non-English speaking population. And it speaks to the governor's administration, DPH, the commissioners, FEMA, and our federal delegation's attention to what we have been talking about inequities and accessibility for our communities. The mayor just alluded to me always asking about neighborhoods, and it's where we need to have this FEMA clinic going into. And today it's launching here, but I have been reassured that when it reaches in the communities, it's going to be in an exact prime location to get our community out and vaccinated. When we talk about education, I want to thank Hartford Healthcare, our local regional providers, and our FQHCs who have been supporting us as local electeds and getting our community educated. I think it speaks to the need that healthcare and accessibility go hand in hand, especially when we're trying to normalize our lives in municipalities. And our federal delegation, I want to applaud you because you're ensuring that municipalities and cities aren't left behind. And we're the first communities that have been strongly impacted inadvertently through jobs and economic impact for our families. And as I speak here today, I was speaking with some of the individuals that came up this morning to get vaccinated, and they're just as excited as I was when I received my vaccination on Wednesday. And it just speaks to the need to continue to educate, the need of Governor Lamont's administration to continue to push to ensure that his cities and his residents are getting vaccinated and we're all living a healthy lifestyle moving forward. So thank you, Governor Lamont. Thank you to the DPH commissioners for listening to us in the municipalities. I just want to say that it has been a large feat, and this is another tool in the Bridgeport toolbox to get our people vaccinated, living healthy lifestyles. And again, Governor Lamont, your administration has been outstanding in listening, looking at it through a zip code lens to ensure that everyone is vaccinated on time, and we're ensuring that those hard areas to reach are part of this conversation. Thank you.
Thanks so much for doing that, too. I'd like to welcome, and I didn't know he was going to be here, but he does a great job in working with the governor on a state level in the State House of Representatives representing the city of Bridgeport along with the Bridgeport delegation. Our state representative, Andre Baker. Let's give him a round of applause. I haven't seen him in a couple weeks because he's been working hard in Hartford, but good to see you, Andre.
Thank you, Mayor. I just kind of found out about the event a couple of hours ago, and I felt it was important that I come and see what's going on here. You know, from the beginning, my district has really struggled. First we had this issues where we weren't having enough testing sites in my district, and now we were at the point where we weren't enough vaccine sites. So I'm just happy with the our congressional delegation, FEMA, and the city of Bridgeport, and also the governor's office, that we have this initiative where we can be able to have this mobile facility be able to move around from different parts of the communities where people are not able to get out. We have a lot of elderly people, and they just can't get out. And we need to be assured that they are going to be treated properly and they're going to get the care that they need. So once again, I thank those of you here, and I continue to thank Hartford Healthcare Facility just being a part of the community. I mean, since they came to Bridgeport, they have really reached out and stepped up and done their part to provide their services here to Bridgeport. So thank you.
Thank you, Andre. So before I introduce UConn's Dr. Lang and the governor, we're honored to have members of the Connecticut federal delegation join us today. And it goes without saying that the backdrop for this is the support financially and the leadership that we've seen provided from Washington, especially from our elected representatives here from the state of Connecticut. And I say that because I've been around, started in government in the early 90s. Dick Blumenthal was around then. I know he's younger than me, or at least he's going to claim to be. But I haven't seen the type of federal financial support directed at need, the way in how many ever years that is back to the early 90s that we've seen in this recent stimulus package and in the American Rescue Plan to help us get through this pandemic. And I tip my hat more than that, and hopefully you'll join me with a round of applause as we first bring up our Representative Johanna Hayes. And as she does, I want to let her know that I was with Jim Himes earlier last week, and we talked about, and I wanted to make the point there, and I'll make it with you and with our senator, and I've said it to all that were there. As much as it's a polarizing time down there and a difficult time to secure resources for your home state or for your neediest communities, it's unacceptable that you would have to go through the challenges that we saw happen in January, in addition to fighting for what's right, fighting for your lives. All that were there and all that stand up for us in this democracy in Washington are our heroes. I want to give you a round of applause as you approach, and thank you for your service and your leadership now in Washington.
Thank you, Mayor Ganem, and good afternoon to everyone. The thing that I would like to say is that it's no accident that this van is launching here in the state of Connecticut. As members of the federal delegation, we were able to put forth a robust grant request to it was very competitive. You know, all 50 states, all of the territories wanted to have a rollout just like this. And because of the partnerships that were already intact here in Connecticut and what was already being done, we were able to put forth an application for consideration to make sure that this happened here. And this is what we're seeing today. From the very beginning of this pandemic, we saw how Black and brown communities were disproportionately affected and marginalized. We saw how our rural communities did not have the same level of access. And these are all of the things that we took into these conversations. From the start, in every negotiation, it was a non-starter to have any plan that did not include funding for state and local municipalities and funding to make sure that we were providing more vaccines, more testing, more healthcare options and resources for people, to make it equitable. This van is going to travel around the whole state. So while Bridgeport is not in my district, I'm here to see it off and to welcome this van to the state of Connecticut, to go into some of these communities where there are language barriers, where there is disproportionate access to health care. In some of the remote areas in my district where these rural farming communities have, you know, miles before they get to the nearest healthcare facility. But also to restore confidence in our communities, because families can be vaccinated together. Elderly people who may not know how to access the online web portals will also be able to be vaccinated. So this not only is going to get us back healthy and on track, but it also is going to restore the confidence that our communities so desperately need. And in true federal form, we have already put in a request for a second van to come to Connecticut. So I join my colleagues, Senator Blumenthal, my House delegation who could not be here today, who have been working hard from the very beginning to make sure that our state and our priorities are reflected at every level in every package that comes out. And we talk about how this is hard, this work being hard, getting care to people being hard. Nothing about that is hard. It's about doing what's right. It's about doing the right thing and making sure that we are caring for other people's families the same way that we want our own to be cared for. And that is the type of work that I am aspiring to do in Washington. That is the type of work that my federal colleagues have joined me in. And I could not be more pleased with the outcome of the packages that have been presented to really deliver help to the American people. I'm going to say and help build back, but it sounds so cheesy, but exactly, to help us build back. You know, we've heard a lot about that over the last couple of months, but the beginning of building back is getting people healthy, getting shots in arms, getting people vaccinated, and making sure that everybody in every community has the same level of access. Thank you.
Johanna, thank you so much, and thank you for being here. Thanks for all you're doing. And to our Senator Blumenthal, I want to thank him again for his leadership, his hard work, and his commitment for so many years. The only problem I have is he is the best one-on-one as far as spending time with individuals. Right, Heidi? And he keeps me on my toes, because if there's an event in Bridgeport, and if I'm not there, sometimes the Senate will be there and say, "Where's the mayor?" So he keeps us on our toes, and that's an affectionate a way to bring him up to the microphone. But he's a committed, hardworking, has made a difference in the lives of so many people, not only here in Bridgeport, across Connecticut, and across this country. Let's give him a round of applause, our U.S. Senator, Senator Blumenthal.
Thank you, Joe. Nobody works harder for the people of Bridgeport than Joe Ganim and A.D. Nevis. And I really want to thank them and the entire council for not only hosting us today, but constantly being at the forefront of the fight for public health. To Governor Lamont, a deep thanks. I'm so proud to represent Connecticut with Governor Lamont at the helm, because he has stood up these hearts with hope, healing, courage, epitomize what Connecticut has done to be at the forefront of this fight against the pandemic, leading not only with a personal commitment, but also with utter and total honesty. Talk about straight talk. That's Governor Lamont. So he deserves a great debt of gratitude to Hartford Health. You know, I've been all around the state. I've seen Hartford Health at work. The frontline workers, the nurses, the administrators, the docs, they have been there for people, as have all of our clinics, federally qualified health clinics. Right here in Bridgeport, the Southwest Community Health Clinic has a mobile van that is going around providing physical, dental, and behavioral health care. And most importantly, from my standpoint as a member of the Armed Services Committee, to our National Guard. You know, everywhere I have gone around the state of Connecticut, including yesterday when I was tested, the National Guard was there. And I mean, in the bitter cold, in the rain, in all kinds of weather, our National Guard has stepped up and really been there for Connecticut. So let me say just a couple of words very bluntly. This van is here on a tranquil, beautiful day, offering hope, healing, and blessings to about 200 people today who will be vaccinated. This van was here because of a fight. It's a fight that I was proud to help lead along with our delegation. It's a fight that involved big stakes, trillions of dollars. It's a fight that we had to win for this van to be here, for countless people to receive the vaccine. $50 billion in federal money going to FEMA are the reason this van is here and the reason we have 30 more of them for the country. 30 vans is nowhere near enough. We need more. We need another here in Connecticut. That's why we've written to FEMA asking for another van here. There's a lot of talk about hesitancy in communities of color. There's no hesitancy. There's no resistance or reluctance that can't be overcome. It's a problem of access. It's a problem of ample opportunity. That's the reason why the death rate in communities of color is double, and why communities of color have received only half the vaccines that others have. This van is equity in action. More than words, more than rhetoric, we need action. And that's what the fight was about, and it will continue. Our colleagues who say we should have gone with $600 billion instead of $2 trillion, this van wouldn't have been here without that fight. This van would not have existed in communities around Connecticut and the country without that fight. Equity in action means real dollars, putting your money where your mouth is. And that's why this fight will continue. And our delegation is united. Jim Himes, who couldn't be here today, my colleague Chris Murphy, all of us. We like to say that we're a small delegation, but we fight above our weight. And we're going to continue to do this fight so that we have this fan and more of them here in Connecticut. And let me just close. We're here in Bridgeport because Bridgeport has the lowest per capita rate of vaccination in the state. This van will go where the need is, to underserved communities, to people who need and deserve better than they've received so far. And I'm very proud to be here with our state's leaders, members of our state delegation, and everyone who is taking the lead in this great effort. We can be proud that Connecticut is facing the challenge and meeting it directly. Thanks.
Again, Senator, thank you for all and for making this happen. We have, I don't know if they, I just want to make sure we give them a round of applause. I don't know if they're going to, if their representatives are here, but Trinity Health New England, I know that Griffin Hospital, Pat Charmel's here. I want to thank them, give them a round of applause for what they do. As we bring up as well, UConn School of Medicine's Dr. Bruce Lang. Doctor, come on up. It was a pleasure to meet you as a fellow Husky. Just let everybody know that, okay?
Thank you, Mr. Mayor. I'm Bruce Lien. I'm the Dean of UConn School of Medicine, here representing UConn Health. First of all, I want to acknowledge the great leadership of our Governor Lamont. Very proud to be working for you. And of course, thanks to the congressional delegation and Mr. Mayor as well. So we are the only academic medical center in the state of Connecticut. We do service. We educate the next generation of physicians, surgeons, scientists, and researchers. And we're very proud and very excited to be part of this FEMA effort to reach out to the communities. We're one of the 4 sites, along with our partners, UConn, Hartford Health, Griffin, and also Trinity St. Francis. We are a little different in the sense that we train 440 medical students at any given time, 680 resident physicians. Many of them are part of this volunteer effort in the van in different parts of the state. I think we have 9 days of this van in 5 different towns. Also, as the medical school, and we also do cutting-edge research. So COVID-19 hit us. We were blindsided. A lot we didn't know. In a very short period of time, collaborating with our partners at Jackson Lab, we were able to study the immunity that developed in people who were infected. We published this study recently in Nature Communications. So healthcare workers who got the virus, we were able to measure their antibodies. The good news is that everybody got the infected got the antibody. The not so clear news is that the level of the antibodies that's produced is relatively low compared to people who have severe disease needing to be hospitalized. So the more severe you had, the more antibodies you have, and which is 2 sides of the coin. And because the antibody is relatively low, I think that pertains to people who have mild disease. That's why we say you got to get vaccinated. Even though you've been infected, you still need to get vaccinated. And we are now doing a study to look at how long does immunity last for people who got vaccinated today. We're going to provide some answers to that, and that's going to be important as well. So very excited to be part of this vaccine effort, very excited to be the only public academic medical center in the state to be doing this under the great leadership of Governor Lamont. and we look forward to contributing in every way that we can. Thank you very much, Mr. Mayor.
So you've heard, and I think it's clear, we're here because of a lot of different reasons and entities, FEMA, Hartford Healthcare, the hard work of our federal delegation. And that's how this ended up in part in Connecticut, but it only ended up there because the governor and his team put together a comprehensive plan that looked and felt and in fact was the best one or the best place for this to start. So that's because of hard work and practical approach by administrators. But it's in Bridgeport, in a city that's underserved in many ways. It's playing catch up on number of residents who've gotten the vaccine because of policy, because of the governor's policies of trying to bring access and equity to urban centers, and this being a demonstration of that with the first in the country. He's also demonstrated, as many have seen, you see governors doing more visually around what's going on in what state, what's going on in another state. What's happened in Connecticut has been a deliberate, steady hand getting us through this pandemic. As we turn the corner with vaccinations and begin to look forward to not only the reopenings that are happening, but a summer and a future post-pandemic. And with that, let's thank the leadership that we've gotten in the state of Connecticut by Ned Lamont. Governor Lamont, welcome, and thank you again for all you do across the state of Connecticut and here in Bridgeport.
Hey, thank you, Joe, and good morning, everybody. Dick mentioned some early days of hesitancy, people not quite sure if they wanted to get vaccinated. I'll tell you, Joe Ganem and I were just waiting in line there with some folks. Some of them been there for a couple of hours. I didn't see any hesitancy. I want to thank each and every one of you back there behind the tree. What that means is a difference. Keeping yourself safe, keeping your family safe, keeping your community safe. That's what it means when you get vaccinated. And we're doing everything we can to make it easier and easier for people to get vaccinated. I want to give a shout out to our delegation and Dick and Jahan and everybody. You're right, you got us here to the front of the line, made that possible. Connecticut, the first state with this mobile van. Paul Ford, thank you. Thank you for recognizing Connecticut where you ought to be. Let me tell you what this mobile van is. It's pretty complicated. You know, you go in there and there are nurses who are measuring out, in this case, the J&J vials. You've got a variety of different refrigeration units. Some are good for J&J, some are good for Moderna, some are good for Pfizer. There is 7 tiers of battery backup to make sure that we can keep the power on. And the power is being monitored from Stuart, Florida, and on phones around to make sure that we can make sure that the vaccine is safe and ready for you as you come. And that's what it means when we say we're going to bring the vaccine to you and make it easier and possible for each and every one of you to get vaccinated. And I really urge you to take full advantage of that. And this van is starting off from Bridgeport. We're going to make sure that nobody is left behind. Everybody who wants gets that opportunity. Even if they're not sure, go talk to your friend, go talk to your family. Tell them, it didn't hurt, I feel a lot better, and now you ought to get vaccinated too. And for Bridgeport, it's going to go on to New Haven. They're in the green. Pat Charmel, Griffin Hospital are going to have the van right there in the green, making it easy for people to get vaccinated. And Jeff Flax mentioned this is a race. And it's a race we're winning in Connecticut, we're going to win in America, and we're going to win everywhere. We have no alternative. And you look around the world, not everybody is winning. You know, Britain is opening up and they've got 40% of their people vaccinated. They're getting back to a new normal. Not Italy, not France, right next door. They're closing down and it's the infection rate is ramping up. Israel, incredibly successful at getting people vaccinated, bringing the vaccine to where people are, giving them the confidence to get vaccinated, getting the vaccine ordered. You know, Bill Hackett's made a big difference with the Guard here, making sure we have a process in place, we have a plan in place to make it work. They had a plan in place to make it work in Israel, not in Brazil. Brazil's on fire. A lot of unnecessary deaths, a lot of unnecessary fatalities. Not going to let that happen here in Bridgeport. We're not going to let that happen in Connecticut. And that's not going to happen in the United States of America. And it's not going to happen because we are prepared, we're ready, reaching out everywhere we can. Tell your friends, your family, your neighbors how important it is you get vaccinated. The vaccine van is coming to you. We're going to make it easy, no questions asked. That's how we're going to get out of this together. It's going to be a great spring. Thanks to you. You know, Mayor, appreciate the chance to be back here in Bridgeport. You're leading by example. Take care, everybody.
So we have a system. If there's any easy questions that are going to make somebody look good, I get to answer them. Any hard ones, the governor always says he'll take. He's pushing Blumenthal out there. Anything of information that we left out, I'll try and field it to whomever can best answer it. Yes. Yeah, I want to get you the answer. My guess is the answer is yes, but I'm going to let someone who knows better than me answer it. Please, come on up.
Hi, good morning. Thank you for the question. So what we're trying to manage is the amount of vaccine we have with the people that came up, and we're doing this in two ways. People who pre-registered, which is a certain number of vaccines, and walk-ups. So we just need to make sure we're not going to overcommit. And what will happen is if we have more walk-ups than we have vaccines, we will register them, have them come back again tomorrow when we can bring more vaccines to meet them. So at the moment, it's trying to manage that. We had to sort of make an estimate as to what we thought we were going to get in terms of people walking up, and we'll adjust as we go forward over the 10 days to make sure we have enough vaccine to meet the demand. Yes. And we were trying to make sure that we were notifying people that it was here, is getting that message out. So yeah, I know it's a nice problem to have, to make sure that we have a lot of interest in people to get here, as we've talked about. It's about access, but we also have to make sure we're bringing the vaccine enough to meet the demand and trying to estimate that. We anticipate we have 200 vaccines we can administer today, so it's trying to balance that. Yeah, appreciate that. Yeah, today it'll be 200 is what we're estimating we can do. We'll do that for the next couple of days, and then it'll expand to 400 in a day. Yes, 400. I can't speak to exactly the federal allocation. The partnership with the state has been critical for us, with all of us who are delivering these vaccines, to administer whatever vaccines come into the state. We commit to getting them out within a week. So that is adjusted on a weekly basis, and we appropriate adjust our schedules to meet that demand.
I think, as Representative Hayes said earlier, it was really because we had a plan. We had a strategy and a plan that the federal government knew we were going to execute. And we had a need. Obviously, the whole country has a need in underserved communities, but Connecticut had a plan, and they knew we would execute on it.
Right, I would just echo that. The need is everywhere. Every community had a demonstrated need, but at the point of when this idea was being floated, it was, what is your comprehensive plan? How will you roll it out? And because of the relationships that had already been on the ground in Connecticut, that plan was able to come together quickly to show that we could implement this quite effectively here.
Yeah, I think we have we've started mobile outreach because we've got a lot of calls, even locally, in order to do mobile outreach, sometimes one-on-one. But the beauty of this is going to go to the neighborhoods. So this will go, I don't know how well you know the city, but this will go to East Main Street, where we have a city building there, the health building there. It's going to go to a place called P.T. Barnum housing, which is public housing in the city of Bridgeport, and it's going to park right there, as we said, on the basketball courts. So it's good. This is major outreach to address the issue of mobility and accessibility. So yeah, absolutely, that's the way it was set up in Washington, and the way the governor's administration and on a local level we help provide the locations.
I just want to add that that part of the American Rescue Plan is to provide funding for towns and cities to do the mobility, to provide access of exactly this kind, to go into people's homes, literally, particularly for seniors who are homebound, and give them the vaccines right there. So this van, as important as it is, in fact, is only one part of this strategy to reach people where they are. Outreach is so important. And I just want to emphasize this point that the governor made about we're in a race. We're in a race against time. We're in a race against a deadly, insidious virus that is evolving and mutating, producing variants that may be resistant to this vaccine. As every public health expert has said, we need everybody to be vaccinated for everybody to be safe. Because as long as the vaccine is spreading and mutating, producing variants, we are all at risk. That goes globally as well as in this country.
I'll just add that there's a component of this that is unprecedented. 100% of the costs that FEMA incurs that the localities incur is reimbursable. So this is completely done because of federal funding. 100% of it, that never happens. Generally, it's a percentage, but like Senator Blumenthal said, this is a small piece of a much larger puzzle to make sure that we are meeting people where they are in every way possible.
The question was, how do we come up with the order, as this is going to go to multiple communities around the state over the next 60 days. And Paul, as you know, we prioritize the socially vulnerable zip codes. Bridgeport was an area that a lot of people still had not gotten vaccinated, so we wanted to prioritize Bridgeport #1. They'll be here for 10 days, coming back at the end of this term as well, prioritizing other places where people are much less likely to get vaccinated. Look, this is a different day and age. It's not like I got mine, the heck with the rest of you. That's not the way it works. We're all in this together. And we only beat this virus if we all make sure that each and every one of us has the opportunity to get vaccinated. They get vaccinated. That's how our community stays safe. Well, I was talking to the folks in the van, and let's face it, J&J is a lot easier because you don't have to track people for a second dose. They've got the refrigeration in there to be able to handle everything. So I do know that we're going to be seeing a lot more Johnson & Johnson over the course of the next few weeks. That's the vaccine that's ramping up the most dramatically. So I think we'll be able to accommodate people as needed. I know they're able to use any of the vaccines, and there's, you know, J&J is easy, that's for sure, but they're ready to go with Pfizer and Moderna as well, Paul.
How are you ensuring that there are Bridgeport residents getting the shot?
I don't know, do I care that much? How do I assure that they're all Bridgeport residents?
No, I don't think we have to.
For walk-ups, For walk-ups, we just make sure that they have they just live in Bridgeport residents.
For the walk-ups, well, we do make sure of that. Hey, thank you, everybody. Beardsley Zoo is right up there. You ought to go enjoy it. Thanks, everybody.
Thank you, everyone. Thank you.